According to the National Organization for Rare Disorders, or NORD, Swire syndrome, which was first described by a London endocrinologist named Dr. Jim Swire in 1955, is a rare disorder in which the reproductive glands fail to develop.
I know I'm a woman, but how could I possibly be born with male chromosomes?
Girls with Swire syndrome have the same sex chromosomes as boys, XY, but they are female as far as their physical appearance, and they have a vagina, uterus, and fallopian tubes. Girls with this sexual development disorder do not have ovaries, however. Instead, they have what are known as gonadal streaks. This fibrous tissue is not able to produce the female sex hormones, so girls with Swire syndrome will not go through puberty without hormone replacement therapy or HRT. It's not known exactly what causes Swire syndrome. However, it is thought that any genetic mutation that alters testicular development could potentially trigger it. In some cases, the genetic mutation can be inherited from a parent, but others may develop a genetic mutation for no known reason. In about 15 to 20% of cases, there's a mutation of the sex-determining region Y gene.
In about 1 in 150,000 pregnancies, a fetus with an XY chromosome, a boy, develops into something else, like you.
Swire syndrome can have several important implications for women's health. This is primarily due to the absence of normal ovaries and the associated lack of female sex hormones. Medline Plus explains that because children with Swire syndrome appear female, they tend to be raised as female and identify as such. However, since they don't produce sex hormones, they won't go through puberty unless they receive treatment with the sex hormones estrogen and progesterone. If they do receive HRT, it's possible for them to go through puberty and develop breasts. Their uterus will also be able to develop, and they can eventually start to have menstrual periods. Additionally, it may be possible for them to become pregnant with a donated egg or embryo. According to Cleveland Clinic, another important health issue faced by those with Swire syndrome is weakened bones. When girls don't receive HRT, it can cause their bones to develop osteopenia, reduced bone density, and osteoporosis, or brittle bones. However, HRT can help prevent bone loss. Additionally, Cleveland Clinic writes that about 30% of people with Swire syndrome may develop a tumor in the area of gonadal streaks. Gonadoblastoma is the most common type. Osmosis explains that Swire syndrome is often not diagnosed until girls are in their teens and still haven't gotten their period. To arrive at a diagnosis, a doctor will consider the girl's medical history, the presence of telltale symptoms such as a lack of a period, and test results. They may also order imaging to help visualize the internal reproductive organs. A diagnostic laparoscopy might also be done in order to provide a better view of the internal anatomy. Chromosomal analysis can confirm the diagnosis. Genetic testing can be done to determine the specific genetic mutation responsible for the patient's condition. HRT and surgical removal of the gonadal streaks are the standard treatments. While gonadoblastoma is benign, it is believed to be a precursor to malignancy, so doctors will generally recommend removing these growths. NORD also notes that people with Swire syndrome may have adrenal insufficiency, which requires treatment. They further recommend genetic counseling for the patient and the family.